Hi all, my name is Rahul and today the broadcast is on Soltius ME, which is a division of YASH Technologies, and how we are driving innovation in healthcare with SAP. So we have here two presenters with us. One is Mr. Kamal Sachdeva, who is the competency head for healthcare out of Soltius Middle East, and also Damian Bonadonna, who is also a healthcare expert based out of Soltius. So I request all the attendees to please hold your questions till the end of the session, wherein we'll open the floor for any Q&A session. Thank you all. Kamal, it's all yours.
Thank you, Rahul. Good morning all and welcome to this webinar on innovations in healthcare with SAP. I am going to run through the healthcare solution with SAP. But before that, I will give you a brief about our company, what we do and who we are. Okay. So we have been in the region for last 10 years. We started our operations in Middle East in 2006. We are based in Dubai and we have been involved in all sorts of SAP implementations across the region. Our main focus areas are, as you see, oil and gas, manufacturing, healthcare, hospitality, construction, telecommunications, education, and public sector. Coming to our footprint and localization capability, we have done chunk of our projects in Middle East, Africa, and Central Asia. Besides these regions, we do have footprint in China, Pakistan, Turkey, and just a point to highlight that we have a localization capability for all the countries that we have highlighted on the map. Coming to our consulting services, we offer complete set of consulting services ranging from IT strategy and roadmaps to project implementations and rollouts. We have participated in numerous continuous improvement initiatives for our customers. We do projects based on best practice solutions, proprietary template solutions, the rapid deployment solutions, and besides this, we do support our customers with staff augmentation on both functional and technical resources. Our main differentiator is to deliver technologies that empower you to stay agile and stay responsive. We provide you with a solid foundation of constantly evolving business technology services and solutions. We always endeavor to have long-term partnerships with our customers and help them with consulting, designing, building, operating, and managing support side for them. We have done a lot of transformation project in the regions, and we ensure that the solutions you have, they are optimized for today and adaptable for the business needs of tomorrow. Coming to the application management side, we have complete range of support services that we provide our customers. And we have various models which include a mix of on-site, near-site, and remote delivery. Our services include end-user support, technical support, operational and system administration support, and a number of business process improvement programs that we do for our clients throughout the life cycle of our support engagement. Okay, now Soltius is evolving. As most of you may be already aware that we are now part of YASH Technologies. YASH being one of the leading technology service and outsourcing partner for companies across the globe. This acquisition has been a win-win for both of us. So what does this mean for you? As a Soltius customer and prospect, this chapter would bring continuity and even stronger technology partner for your business. You will have continuity with the people and technology and resources that you have come to know and trust at Soltius. You will have additionally an opportunity to benefit from YASH substantial resources and global reach. As you may be aware, they are one of the leading SAP provider across the globe. So together with YASH, now we believe we are bigger and better positioned to provide you with innovative solutions and services that will significantly enhance our capabilities. This is just a snapshot of our global reach. So we have been now in operations for 20 years and are considered amongst the largest SAP service providers globally. Our global headquarters is in East Berlin in US. We have now a total of 4,000 plus employees, and all of them have extensive industry and domain knowledge. We have been rated by various agencies as one of the best employers to work with. We are partner of choice for around 350 plus large enterprises, and these are spanning across the globe. These do include 75 plus Middle East customers for the regional reference, and a lot of Fortune 500 organizations as well. We have 30 plus offices and innovation centers that we call them spread across the globe. And last but not the least, with our strong customer focus and value add, we have been achieving a double-digit growth for the period of past 5 years. So that gives you a bit of idea about our capability and reach. So our presence mirrors our customers' footprint. So as you may find, we have offices across USA, Europe, India, Far East, Middle East, and now one in Brazil as well. So that is where most of our customers have been located, and we have the development centers as well located all around. I hope that gives you a brief about our capability. Now we come to our healthcare solutions and innovations using SAP. So our solution is built on SAP platform. We use the SAP ERP basically for all the core modules, which is finance, materials management, HCM, and payroll, plant maintenance, and host of other central components of ECC. Then on top of ERP, we have a solution for patient management and patient accounting, which is the ISH solution. This is taking care of the complete patient life cycle on the revenue management side. And on top of ISH, we have our clinical solution, which is the ISH Med solution, and this is now a Cerner offering. We are going to talk in detail about these in the subsequent slides. And on the top, you will see there is a slide, there is a box highlighting the Soltius add-ons. These are the value adds and the localizations that we have built on top of SAP, and these are to cater to the regional needs basically, and do the process automations for the processes that are generally prevalent in the region. Then on the right, you will see we have a layer for budgeting and planning, where we use the SAP's BPC tool, which is one of the best for doing budgeting, planning, and forecasting. We have mobility solutions spanning across all the modules, and one of the best one is the SAP EMR Unwired, which is widely used by physicians and nurses and all the care providers in the hospital. Then right at the top, you have a business intelligence and dashboards, which are sitting across all the modules, and they feed in data from all the systems and are presented on the dashboards to monitor the KPIs for our healthcare providers. So these KPIs includes for a range of roles, from a CEO to the hospital managers to to a finance or a CFO head. We are going to go through these in detail in the subsequent slides. So coming to the SAP's patient administration and billing engine, the patient management provides complete end-to-end solution for managing the inpatient, outpatient, and day patient cases. Using the patient master data, you can model the inpatient case or outpatient case for the patient, and their movements like admissions, transfer, discharges, or visits can be tracked within the same case or encounter, what is generally called in business terms. You can access the relevant data by patient or by case, as well as in the overview of a complete care unit or outpatient clinic. So this provides you opportunity to schedule patients in the corresponding organizational unit easily. The solution relies on the ISH master data and key elements such as organizational units, building units, which are to complement the structure of the hospital. So the hospital structure is completely mirrored within the system. We have business partner data to handle the physicians, the insurance providers, the employees. So they are created as a business partner and provide valuable information for a case. Then you have a service master data, which is basically a tariff catalog. We have catalogs for medical coding, for procedures and diagnosis. We need to have a master data for your insurance plans, which are managed via contract schemes. Then we have the role-based clinical workstations, which is basically a tool for easy user interface. It combines user-specific patient lists and the functions that the role may be needing. The end-to-end process under patient management are covered by the system. So these processes includes patient administration and services, tariff and price controlling based on your price list, billing and insurance contracts management. Then you have processes, complete processes for claims handling, which is covering the e-claims requirements, and incoming remittances. So on top of it, the basic medical information like risk factor, allergies, medical coding, these are also provided within the ISH system. You can track your inpatient and outpatient by his movements, which are all created under the same case. And then it also has a deep functionality for resource planning and scheduling, so which does include appointments and bed scheduling and managing the waiting lists as well. So some of the salient feature of an inpatient case. The inpatient cases, you can handle the admission process for both planned and unplanned admissions, like from an emergency. So there is a scheduling system based on pre-registration and waiting list functionality, which helps in a quick overview for the planners or the appointment desks. The admission process is really quick owing to the automatic data transfer that happens from the scheduling. There are separate variants and templates for the end user to manage different types of admissions. Basically, you have a template for a surgery admission, maybe a separate one for delivery, for newborns, for observation cases. Then for emergency, there is another set of templates. We can also manage the companion admissions within the inpatient case. And for newborns, the case assignment is possible with the mother's case, and similarly for companion, the case assignment to the patient is also done. The bed assignment is done considering patient's eligibility for the bed class into consideration. You have the pre-approvals and pre-authorizations, which will cover the eligibility for the patient as well. There are processes to manage the patient transfers, which could be a ward transfer, a room transfer, or just a bed transfer. And then sometimes you do have a physician transfer, which is basically moving the patient from one specialty to another. That is all covered in the same case, using the same case. So there are services that are consumed within these inpatient cases, and these are recorded against each movement. So if a patient was in ward A and there were a set of services offered, those will be recorded against the particular movement of the ward A. So this facilitates the activity-based costing and the profitability analysis later on for the financials. Then coming to the discharge process, the discharge process takes into account all the open orders just to validate all of those have been completed. If there is an open order which has not been completed, you need to cancel it before you can discharge a patient. The respective department's confirmation is really important before the discharge process is completed. This is all done electronically within the system. You get an automated process to manage inpatient returns for pharmacy and medical consumables basically. And once all these processes are completed, then the discharge is possible within the system. The patient financial data is managed along the complete value chain for an inpatient case or for an outpatient case as well. So it starts with a down payment for a self-payer or with an insurance approval with the defined limits and the ceilings for the covered patients. There are alerts for the admin user in case the eligibility amount has been already utilized. So the patient admins will get the alerts that the covered amounts are already done.
We also have the capability to do the pre-billing and before you attend the patient, because this is a requirement in some of the countries like Kuwait and here also in Dubai. So the system has this kind of flexibility which lets you configure certain parameters, and in this case is thanks to our Soltius add-on. This is possible, which we will talk later on. Right?
Yeah, that's a good point to highlight, Tanya. Okay, then moving on to our Soltius add-ons. As I briefed you earlier, that we have a set of solutions which are there to manage the localization need in the region, which is across the Middle East pretty much common. And there are a lot of processes that needed to be attuned to the regional requirements. So what we have done is we have created a full set of these value adds, and these are delivered along with called as Soltius add-ons. So these are numerous in numbers, but the important ones have been highlighted here. These includes the e-claim process, the point of sale, the services package management where DRG is not in place, the contract scheme localization. Then we have some automated workflows for managing the discounts, meal ordering and diet management solution, the main cashier desk functionality, then the profitability analysis and costing solutions. So yeah.
Yeah, so this is like a very, very good value that we are adding to our customers because these are like based on our experience in the regions, in the different regions. So we can cover like a wide range of functionality that is not in the standard SAP system.
Yes, that's true. The screen presents a bit of detail on the functionalities that are available within the add-on. So coming to the medical coding and the e-claims process, which is widely used, especially in UAE. The process is meeting all the HAG and DHA requirements. So this can be deployed for a e-claim solution in total. You don't need a third-party application after you have this solution. So there is an automated process to capture the pre-authorization from the insurance provider. We follow the rules for drug codes and rule sets for pharma and medical consumables. We have for outpatients the fee for service billing, which is taking into account the E&M code requirements. For anesthesia also we have a fee for services, and for per diem billing for the accommodation and other related services, that functionality is also covered within the add-on. We have inbuilt integration with the central post office for the claims validation and submission. And we also have done integration with the insurance providers for posting of inbound remittance and rejections. So we do have process for managing resubmissions and managing the count of resubmissions. As you know, after the 3 denials, you cannot resubmit it. So those controls are already inbuilt. This is just representing the technical architecture, how we are integrating with the HAG post office or the DHA post office and then to the insurance provider, and then absorbing the services back from the insurance provider into SAP. Now coming on to our point of sale solution, this one is built on a BAP, which is the SAP platform. So this has 2 variants. One is for the pharmacy and another one for commercial items or the gift shop that you have in the hospital. So the highlights of the solution are that it is fully barcode enabled and has a capability to have input from a scanner or a handheld device. We follow the batch management and the expiration check process. Basically, the near expiries or the expired items are not allowed to be issued. There is an alert for the FIFO, means the first expiry should be always first out. We have the ability to sell a unit dose or the packs, as in this region I think there is a lot of requirements to sell unit days to the outpatient as well. We integrate with ISH for the pre-authorization as well as for the returns management from the pharmacy. And then there is an integration with MM and FICO for automatic stock updates and the GL updates. We also built an integration with the card swiping machine to capture the credit or debit card data. And then we facilitate multiple modes of payments for a single transaction, which is again a very widely used process in the region. Coming over to the billing localization, this is one of the most widely used in the hospitals that we have done. This is built on top of SAP's insurance plans and the contract schemes. So what we have done is we have absorbed all the parameters that go into the regional plans and created our own add-on. So this ensures that the payment distribution is fully automated and it is not relying on any manual inputs. What it does is that it has reduced the rejection rates for our hospitals, that those who have installed it, and now means they have these rejection rate as low as 0.2 to 0.3%, which was like 2% earlier. So this is the one which is our unique offering, and no other product is providing the same. We have a solution within billing for managing the packages. This is for those hospitals where DRG is not in place. So we can manage the surgery packages, the delivery packages, outpatient packages for dental, physiotherapy, and then the healthcare checkup packages as well can be managed through this package management add-on. And then the discounts or the promotions that are prevalent in the region. We have created automated process workflows to manage these, and all the electronic approvals are recorded within the system. Coming to the add-on for the main cashier desk, this one is widely used by the treasury people. This is to enable the receptionist or the sub-cashiers to transfer the cash collected from them to the main cashier. So this tool provides a breakdown of the payment modes that each user has collected, and the main receptionist or the treasury officer, he can match it, and then the automatic postings will be enabled so that the transfer from the sub-cashier happens to the main cashier. Once this is posted, the cash position is updated, and for all non-cash transactions like check, credit card, this will be posted to the respective incoming clearing accounts basically. If there is a shortage or excess, we have again a configurable process to manage it. So as per the hospital needs, we map it within the add-on. The patient diet and meal ordering, this one is again built on top of ABAP, and we don't need again a third-party application to manage the meal ordering for the patient. This one covers means all set of functionalities for diet types and diet categories. You can set up your meal cycle times for breakfast, lunch, evening, snacks, dinner as per your hospitals. That is all configuration. There is a provision for late entry for those patients who were admitted late evening or in the night. You can capture patients' food likes and dislikes. You can take orders for patients' companions as well and record them. And then we have a report for kitchen staff by meals and diet types, so that they are able to plan it in advance. And additional monitoring report for nurses and dietitians. They are within their workstation, they can monitor how many patients and whose diet has not yet been assigned. Okay, now coming to the ISAT Med solution, Damian is going to talk a bit about it. So I will just hand it over to Damian.
Okay, so what happens is like you have the SAP platform, which is the ERP. On top of that, you have the ISH solution, which takes care of the patient administration and billing. And then on top of that, you have what is called ISH Med Basis, right? Which is now a cerner solution, which manages all the clinical side of the hospital, right? So this has been in use for over 20 years now, and is evolving, right? And is also being planned to get along with SAP for HANA, right? So this solution also is going to be in the same pipeline with SAP. And as you can see here, this is where ISH Med is being used all across the globe. We brought ISH, the first ISH Med implementations in Kuwait and in UAE, right? So successful implementations. Well, you can see in the map, right? It's almost everywhere, and you have like around 350,000 people, users using ISH Med solution. So what happens is that this solution is divided in different packages, right? So you have what is based on licenses, and then you have the basic medical record, which covers the most important basic and core functional functions in outpatient clinics, service facilities, and care units for the communication, the planning, and documentation in hospitals. right? So in this basic medical record, you basically you have the basic flows with the clinical ordering, so the doctor can order examinations, and then you can get the connection to your laboratory system or your radiology system, and then you also can create the clinical documentation for this, like notes. You can have some physician, like a discharge letter. You can have the triage for the nurses. All this is covered in the basic. So you have the also workflows there. There is progress documentation, occupancy management, where you can see in a graphical view, the occupation of the beds in the hospital. You can you have a special model for transport, for requested transport, right? And then you have the transport service that is taking the patient from one place to the other. This is especially used in big hospitals. Then you have the connectivity module to, as I was saying, to connect with different systems. You can also integrate dictation. You can integrate images, and then you can the findings and the archiving connector also to some at some point to connect to your archiving solution. Then we have the advanced medical record, which sits on top of the basic one, and then you have all the medication which comes from the ordering to the dispensing to the connection with the pharmacy. Then you have the nursing, which has some specific tasks that can be assigned to the nurses, and then you can mark them as completed. You can tell them, this is the way you need to do your tasks. You have physician orders, which are like unstructured orders, so it's mainly text. Then you have the vital signs, which you can also connect to some monitor machines. You have the smart chart, we will talk later, documentation workstation, which is also mainly used for the nurses, and the clinical overview. And then you have some more specific solutions, which are their pathways, which we'll talk in detail later on. And then the surgery and radiology, which we also take a look later on. So what happens is, like, there is a new Smart UI initiative that came with the redesign of the ISHMED architecture. So as we said before, this is all evolving, right? So it never stops improving. This architecture is based on 3 pillars, which is the overview, the patient, and the application. The overview is like this screen that you can see here as the patient groups. So it gives you, as we said before, an overview of what is going on in a certain ward by certain filter, by certain user groups, right? So I can see, I am a nurse and I want to see all the patients that are in a ward. I can use these patient groups. And also I'm a doctor, I want to see which are the surgeries that are assigned to me today. I can look at them here, right? You can see the patients that are being discharged, and all this is very also, you can customize it a lot, right, to like your needed. You can change the different card size and the different views, right, and different filters there. So we'll go to the next slide. We can see here, for example, this is a different view, which is a room view. So you can see by the specific workstation which are the rooms that are being assigned to them. So you can see like the patients are without a room, and then you can assign the patients to the room. So it gives a very, very graphical overview of the patients in a certain area. Here, let's say that you are in the patient groups in the previous screen, right? And then I want to see a specific patient. Then I can come to what we call the patient profile, which is you can quickly view and process the medical information of a patient via with an intuitive user interface, right? What we call, as we said before, Smart UI. So you can see here the finding, the documents, the measurement values. You can drill down in the details, and also here you can order a medication for the patient. You can order an X-ray. You can add progress notes, right? So here basically we have, I would say, the document, examinations, order, diagnosis, vital signs, lab values, medication orders, progress, documentation, even the medical nursing administrative services. We can see the smart chart there, we will talk later. You can see the appointments and movement, the surgery, the procedures, and you can configure it also to your liking. You can see here, you can move things around, and also you can develop your own add-ons here to show a specific data you want to have in the system.
So this is basically providing you with the complete EMR.
Yeah, this is what we call like the patient profile is what is the electronic medical record. So here we have a better look at what is the smart chart, right? So you get the graphical interface where you depict the results and interaction of various events with regards to the patient treatment. So you can see how a certain medication treatment impacts the patient, like his vital signs, blood pressure, lab values. This is thanks to a timeline representation. The idea is to make it look and work as if it is like a paper chart, right? That the doctors are used to write them. You can see like previously the doctors, the blood pressure, it is made by pen, right? In a paper. So here again we have it's configurable. You can show additional information when you use the mouse over certain areas. You can change the case, the time period, right? You can make it full screen. So again, it interacts with order, medication notes, and different elements that we were talking about. So you can see here that we are, everything is kind of getting interconnected, right? Here's like, for example, a screen for service ordering, where you just select quickly your services, and you with 3 clicks, you can just ask for X-ray, right? If you don't, let's say you don't have, they don't have a, or a MRI or CT, they don't have, they don't have metal implants, let's say, you can, just order it without completing additional information. And this again is configurable per service, and you can have favorites and templates on it. The surgery module is a module for the operating departments in the hospital, and it supports the planning, the execution, and the documentation of the surgeries. So the groups that benefit from this solution are the surgery nurses, the operating surgeon, the central surgery management, and the patient clinic and the anesthesia staff also, right? So it is integrated into the whole solution. So you have everything in the same system, right? So from the ordering to the scheduling to the documentation of the, we'll see in the next screens. So here, for example, we have the surgery planning and scheduling. So we say it's a multi-level process, which involves, again, the previous groups that we were saying, surgeon, anesthetist, and nursing staff. You can plan the requested surgeries in the operating rooms that you see there, based on fixed time or based on sequences. You can also determine the surgery team, right, that's going to be assigned. So then you can do the rescheduling. You can, you can monitor also here and have a waiting list management. Here we go to what is the surgery workstation, where is the documentation takes place. So you configure different situations, let's say like surgery documentation and anesthesia documentation, which each of them have assigned to a different occupational group and having different tasks to be completed. So the team, if it is not defined yet, it is assigned and confirmed here. So it's also the central point where all the relevant information from the EMR is displayed, like allergy, risk factor, vital signs, preoperative lab values. The documentation can be done with the dictation support. You can integrate the smart chart that we saw before also in this solution, so like that. You can see it's like very complete. How you reach to this point, like you create the clinical order, and then you say like to schedule the surgery, then it's planned, and then once the surgery is about to start, then you come to this screen, right? And the documentation that can be done here is like the incisions, suture times, the material, the count checks, positioning, disinfection, drainages, dressings, and also has integration with material management. So whenever you need a material set for a certain surgery, it can be documented here. And it has an impact in material management in the ERP. So next to it, we have, we said before, this other solution, which is Pathway, which is basically a clinical decision support system. Right? So you get better processes due to the predefined steps and simpler rotation with clearly arranged word lists and faster decisions, thanks to established proposals for action. We can say that clinical pathways will standardize the workflow for recurring clinical pictures. So this is the high-level introduction, right? So you will start with the preliminary diagnosis, and this information then will be available as a pathway definition. So then you can define how you diagnose, treat, what are the surgical indications, the surgical contradiction, the frequent complications, etc. This is all can be defined by you. Here you have the pathway monitor, which is one of the central components of the solution, allows you to track the patient pathways. And the patient pathways, we call it when we define a treatment pathway and we assign it to the patient. So here I can overview all the patients and how the pathways that were assigned to them. And you can also perform the steps, or you can even edit the treatments if you're authorized to do so. Next we go to the radiology module. Which supports the work and communication processes of the radiological department, from the examination request through the scheduling of appointments and the preparation of the patient to the examination and creation of findings. So you have the whole process there. You define the communication events and interfaces that enable the exchange of data between our radiology solution and then the modalities, these examination devices, and also the image archive systems or PACS, right? So again, you have the service ordering and service management, which is same as surgery. Whenever you order something, that can translate into the patient billing, right? So it's integrated. The scheduling, the documentation, and also we can see next the radiology workstation, which is a central tool for the radiologist. How it starts is like with the ordering. As we saw before, you can have like a simple 3-click order, or you can also go into details, like if they have metal implants, pacemakers, you know, if they have allergy to to some contrast medium, and there is some standard information. Also, we can integrate some custom validation that you might have. Here we can see the findings workstation we talked before. We said like the central tool for radiologists and supports the finding creation for radiological examinations with finding tasks. Then you can configure and create the finding reports, and you can also access the contextual patient information, like the allergies or the case relevant data. And you have different parts, components in the screen, which you have the header, the task list of the patient that you need to take care of, documentation area, more detailed information, the patient viewer. Right? So here's where the process ends with the creation of the finding report. You can see also that the connection to the PACS to check the images is done here. Next, we have what is the EMR on wire, SAP EMR on wire, which is a mobile app for physicians and nurses to have as easy and secure access to the relevant patient data right at the point of care. The app connects to existing clinical backend systems, including hospital information system and imaging systems. So it's not necessarily connected to SAP, but it is ready to connect to SAP. And it displays the relevant data for each patient in a clear and easy to read format. It's available also for Android and iOS. So we'll see next that this is the list of features that the app have. So you can have the list of patients, and you can also filter them. You can make your favorites. You can assign tags to them. You have the integration with images and charts. You can see the documents that were created in SAP before, like the findings in the radiology. You can see the progress notes, again, enter in SAP. You can capture notes. You can see the lab results, the DRG codes, the patient demographics. The extensibility means that you can add more functionality in the terms of HTML5 applications. You can also see medication. You can order services, right? So this is very useful for patient rounds, for example. Next, here you can see example of the patient details. As I told you before, you can make them favorites and add tags to them. Right? These tags are per user also. So it's very customized. It's very convenient for each user. So you can, we said before, here's like the screen how to order the services and how you can add the favorites to them, right? Also the draft functionality is also embedded in the application, right? So the same as an email, you can just save and then later on just confirm the order. Here, we said before, you have the PAC viewer. So you can see the images. So once the connection to the PACS is configured, the images for the patient are shown, and different actions can be performed, such as grouping images together and start a slideshow, pause it, and then adjust the brightness and contrast. Then in this screen, you can see how maybe we can group the images before, and then we can make a comparison between them. And you can also have zoom in and zoom out functionality. So this connects directly to the PACS. So that was the overview for ISH Med, right? We have many more features, but time constraints are also thing.
Well, that was a good overview, Damian. So, as we said before, with the change of the interface, the Smart UI, which has a very innovative one, and it has done away with the traditional interface, which was the major drawback of the SAP clinical system. So now no longer the doctor has to navigate through many screens and many clicks. It is all very easy and intuitive. So that has been a significant innovation from Siemens and Cerner that has taken to this level. Okay, so moving on to our next solution, which is budgeting and planning using SAP BPC. So the BPC engine is used for basically planning, budgeting, and forecasting. This is within the single application. It is sitting on top of our SAP solution. So it is getting the data from ISH, from ERP modules, from the clinical modules, and then you are able to massage the data according to your whims and fancies. You can easily adjust plans and forecasts, speed up budgets and the closing cycles, and ensure that the compliance with the financial reporting standards are met. As I said, the tool derives data from multiple SAP sources. This could be like from a GL, from a payroll, from an employee master, various patient-centric information like bed days, occupancy rates, average length of stays, and number of visits. These are helpful to arrive at the current state and the planned state. So afterwards, you have pre-configured models on reimbursement modeling, which is taking a lot of input from the KPI projections like patient days or admissions and visits, department expenses, which are again driven by parameters like workload, efficiency, inflation. All these parameters can be customized or configured within the BPC system. The same drivers can have multiple values based on the departments. So say for example, you could have a separate percentage each for your routine departments, your ancillary departments, and your administrative departments. So it is not fixed, but having a variable proportion. The budgets can have multiple versions stored in the system. It is always like iterations of the budgets that are there in the hospital. Those can be mapped within the system using the versioning tool. Those are all there, and you can compare between the two versions anytime. Until the final one is approved, these versions will be available for analysis. Once the final is done, then you lock it for editing. For the approval, you can have multiple layers of levels of approval. The approval hierarchy is predefined, and again a system configuration. So in the end, there are a lot of pre-built financial reports for the controllers and the department managers to see the variances between planned and actual, and they also help in controlling the department expenses and the cost centers and profit center reportings. The data can be then fed back from BPC to the SAP ECC system so that you can have an alert mechanism for the users well in advance when the budgets are going to be exhausted. So this provides a very comprehensive functionality on the total planning process. Coming to the dashboards, which are a KPI monitoring tool. So for a corporate hospital, we have a set of KPI reports that have been pre-built and presented on the dashboards. We use business objects for the presentation layer. So we have wide set of KPIs for the enterprise, for the facilities and equipment, hospitals and clinic operations basically, for the care providers, and for the patient admins. So the example of these is here. So here on the screen you see this is a CEO's dashboard, wherein you see this is an enterprise with the multiple facilities. One in Dera, downtown Gardens, and Marina, and the indices or the KPI indices for each of these facilities are tracked on the same dashboard. So the CEO can drill down to the core measures for a particular facility and from there navigate to the information specific to a single KPI. Suppose he wants to have a detail about patient management core measures for a marina facility, he can click on the quality management measure and then furthermore drill down to the relevant KPI, and suppose the average length of the stay, which is the one demanding his attention, he can then drill down further to see what is the area of concern there. So it is a very good tool for him to analyze the complete enterprise performance and what is lagging where. So coming to a dashboard for the workforce management, it is just a snapshot, means these dashboards are completely configurable, and the presentation also can be in any form of chart that you need. So in this snapshot you will see that the KPI information for a month and a comparison with YTD numbers and goals is available. So you also have the KPI in a chart form with information of 12-month rolling trend being displayed on the right. And to give it more context, the census information for the corresponding period and the productivity and staffing information is also brought into the same dashboard. So the combination gives them a good overview and they can do their controlling from here. So similarly, this is a snapshot of another dashboard for operations management. So this is covering the KPIs such as admissions, midnight census, admissions from emergency, unplanned readmissions, average length of stay, long stay patients, wait time patients. So these are like the KPIs that all the operational people are interested in. So we have all these pre-built and these can be easily adopted in your healthcare environment. You can easily filter by by facility, by departments, and by profit centers from the same dashboard. And just a last snapshot. This is a snapshot for monitoring the physician's performance. The KPI related to a particular physician are mentioned, and you can analyze the physician's contribution to total IP days, his average length of stay, the patient's average length of stay for that physician basically, number of cases, and then on the right hand side you have his or her financial performance, wherein comparison of collection versus charges is also available. And once again, to reiterate, these dashboards are highly flexible and can be designed as per your need. This is just a representation of a particular scenario which we thought is very useful for the day-to-day operations of a physician. These are indeed powerful tools for managing operations and monitoring performances. Okay, so that was a snapshot of our solution or an overview of our solution. Now, in the end, just to reiterate how we can help you. We have proven solutions for the healthcare industry. We have been in the region for last 10 years and have done number of hospitals using SAP, ISH and ISH Med solutions. We have experience in translating the complex business requirements to IT solutions. Again, a number of references covering the region. And we can support a local project with a regional perspective and international focus. We have all sorts of AMS models, which is basically 24/7 support or on-call support, the near-site support, the remote delivery, and we can be a partner of trust for you. That was it from my side. I will hand it back over to Rahul.
Hello, Kamal. Thank you so much for your informative session. We got few questions from the participants, and I would be grateful if you can answer them out.
Sure.
So So the first question goes this way. This is like, what is the general time frame for the implementation of our solution?
Yeah, typically for an hospital with 100 to 350 beds, the duration would be typically 8 to 9 months. Means this includes ERP, ISH and basic medical record implementation, which we do in parallel. Generally we phase out the solution. The advanced clinical record and the specialized clinical modules, we will do it in a separate phase, and those would be another 8 to 9 months. So in total, if you are looking for a complete solution, it will be 1.5 years of project.
Okay, that was great. And there is one more question ahead, which says about like if there is an acquisition, or like say if a hospital or a healthcare organization has a merger or acquisition, there are like frequent additions that need to be done to the system. So how quickly that system can be adapted to such entities?
Okay, yeah, that is a good question. Actually, what we do is we create a rollout template for the hospital we implement. This enables the hospital's IT staff to set up the new premises or new facilities themselves. They don't need to rely on us for the rollouts. Following that templates, they will be able to roll out to a new hospital, say within 3 to 4 weeks maximum.
That's quite good time. Thank
Yeah,
you so much
it
for that
is.
also. And there is one last question that we would like to conclude on. So
Yeah.
there is like as we see, the healthcare organizations are different from one another. So now is that their billing process. So what the question is all about, like, as the billing process is very complex, we not only bill before the consultation, but also have a different set of prices according to the insurance provider. And how is that scenario can be covered?
Okay, yeah. We spoke about our localization on the billing side. So what we have done in that is that there is a scenario for pre-billing, there is a scenario for multiple prices per insurance. We also have different pricing for, say, syndicate providers and the government institutions. So you can manage multiple price lists and all the complexities that a hospital is faced with in the billing. So during the course of our, say, 7 implementations that we have done throughout the region, all those scenarios have been taken care of.
Okay. I hope that everything is covered over here, right from the expertise to service and over the solution as well. And the questions are also like timely answered, and I'm grateful to you, Kamal and Damian as well. So I would like to conclude it here and hope the same is with you.
Thank you.
Thank you.
Thank you so much.